All right. So if you have read and understood, considering it history-taking station, kindly please begin.
Yeah, I entered the station and I washed my hand. Hi, I am Dr. Ali, one of the surgical doctors. May I confirm your name and age, please?
Hello. Yeah, I'm Smith. I'm 56 years old.
Hi, Mr. Smith. I'm not here to ask you about your son, problem. And I don't worry, I am sure that everything you tell me will not be disclosed without your permission. Is it okay? So
Yeah,
what
yeah,
bring
okay.
you here today?
Um, I don't know, doctor. I think I'm not myself like
Oh,
before.
yes, thanks. I'm so sorry for hearing
I
about it. Yeah.
I have lost my nature.
Yeah. So when did you first
So
notice that?
okay.
When did you first notice about your loss of nature?
Some time ago, so like for a few months, for a few months.
Oh, yeah. So, did you find that this difficulty uh, where began getting worse or staying the same or improving over time?
I think I think it's getting worse, maybe. It's not
Oh, yeah.
improving at least.
Yeah,
That's what I know.
yeah. I'm so sorry that. But have you noticed anything which made your difficulty become worsen or worsen? Yeah.
Excuse me, I didn't get you.
Or which made your
What
difficulty
was the
become
question?
worsen? Yeah.
Yeah. I think it's getting worse.
Oh, yeah. Which made it begin worsen? Any related factor which made the difficulty become worsen? Hello, do you
I
hear me?
don't know anything. I don't know anything that's making it worse.
Oh, yeah. So do you find difficulty in studying all the erection?
Yeah, I cannot get it done.
Oh, yeah. So do you find that your erection is sufficient enough for the sexual for penetration?
No, I don't think so.
Oh, I'm really sorry about your difficulty. Yeah. So and do
Thank
you
you.
that do you think you and your partner get the satisfaction after the intercourse?
I don't think so because I cannot have proper intercourse.
So how about I want to about your ejaculation. So when did you get your ejaculation at the before the intercourse, during the intercourse, or after the intercourse?
I cannot get to that point because I cannot get the erection at the first
Um,
place.
So how do you experience your erection during the night or early morning in the early morning?
Yeah, I think I don't have. I see myself sometime. I get in the morning,
Yeah, thank you.
uh,
So,
in the early
yeah.
morning when I wake up.
Have you experienced pain or discomfort during the erection or sexual intercourse?
Pain?
Yeah, pain. Yeah. Do you have pain?
I no pain.
So, do you know that about your changes or your penile curvature?
No,
No. Okay.
nothing like that.
So I would like to ask about your personal question. Is it okay for you?
Yeah, yeah, of course.
So do you have that experience that change in your sexual desire?
Desire, I don't think, because I like to have proper intercourse and make love, but I think I cannot. I'm getting like disappointed by this.
Oh yeah. Can you sleep well?
I think my sleep is okay.
Oh yeah. Do you have experience of any low mood?
Maybe sometimes because of this, I think I get. I'm thinking about it a lot.
Yeah, I would like to ask about mood of your personality. Is okay.
Yeah, sure.
Oh, so how about your work? Is okay in your work?
My walking,
Yeah, your work condition. Yeah.
Okay. Can you summarize your history
my
now,
work.
please?
Yeah, I have lots of things to deal with, and this affects my workplace. I think I'm, the stress of work and adding this to it, I'm thinking about it a lot. So I think I'm having a lot at work.
Yeah.
Yes,
Thank
thank
you
you.
for your time.
Can you please summarize your history now?
Yeah, I think the history taking. I took the history of the 30-year-old gentleman with the um cheese complaint. Cheese complaints or loss of his nature for the two men, and which is associated uh which is associated with difficulty in erection and question erection is not strong sufficient strong enough to for penetration, and they don't get the full orgasm, and there is no pain,
Can
and
you,
there
yes,
yeah.
so what are your provisional and differential diagnosis for him?
My provisional diagnosis is the sexual irredentive fashion due to the some psychological problem.
Okay.
Yeah.
And differential diagnosis?
By differential diagnosis, maybe the some hormonal disorder or some organic causes.
How would you confirm your diagnosis? What investigations would you ask for?
First, I would like to do the full examination, and then I would like to do the some blood test like the full blood count. I would like to do the ultrasound. I would like to do the hormonal assay like the ACTH, testosterone. I would like to also check about the ultrasound abdomen and jugular ultrasound for the P9 artery. Yeah.
What treatment can you offer this patient?
First of all, I will manage according to the multidisciplinary team. I want to do the provide the psychosocial counseling for this patient for him, and uh, I would like to give him the medical treatment like sedative. Yeah.
Okay. Bell has gone. Thank you.
Thank
Right.
you.
Out of all the history taking stations, this is the only history taking station in which before you'll begin and before you'll give the confidential statement to the patient, you'll ask for chaperone.
Yeah, I
Because
get. Yeah.
Yeah.
this is a very private nature of history taking. Because in this one, all the questions that you ask your patient are of very private nature. So before you begin, you have to ask for chaperone, right?
Yeah.
And
Yeah.
then,
I forgot it.
yeah, that was first wrong in
Yeah.
this station. Second wrong was because your provisional diagnosis was psychological impotence. So
Yeah.
you have not established by asking your patient questions which narrow it down that some
Yeah.
particular event took place in the life of this patient which has led to this situation.
Yeah.
It says he is father of two, but it does not says, and it says it affects private life, but
Yeah.
does not say to what level. Private life maybe he's been divorced, wife left off, wife cheated on him, or the partner does not even have to be wife. It can even be a male partner. Person could even be gay. So his partner cheated on him. There was a business stress. Business partner cheated on him, or there was a pressure or stress at workplace. So any question in the beginning which could have, or in the during the history taking, in which you would have narrowed it down. So in this way, first chaperone, then even provisional diagnosis was not narrowed down. Then even the differential diagnosis that you asked, none of the questions were asked to rule that out.
Yeah.
So these are the 2-3 mistakes that you have done. Investigations, among all these investigations, there are also many other hormones that you'll do, like serum prolactin, or serum FSH, or serum LH, or ACTH stimulation test. Urinary microscopy, like culture and etc. Or these tests are relevant, which could have been done to rule out, and even the PSA test, if patient gives sufficient history, and serum testosterone, free testosterone levels. So these are the levels that were supposed to be ruled out, and even more deeply, like, questions could have been asked in order to rule that out. So what I would suggest, if you want, in the drug history was not ruled out, more importantly. If this patient has all of a sudden started taking any medications for some particular reason, like any antihypertensives, or because these
Beta
are
blockers.
yes, because all of a sudden, if patient is taking any medications, lipid lowering medications, any statins, any alpha reductase, any antidepressants, any antipsychotic drugs, anything, or has been taking just the testosterones or any anabolic steroid, any medications, right? So that history also needs to be ruled out in order to establish your diagnosis. So these 2-3 bigger mistakes make this station not a success, right?
Yeah, thank you, ma'am.
Good.
I
Thank you.
didn't finish all the question yet.
Yeah, you couldn't
The
get
time-
to.
Yeah,
So my one advice would be that if time goes on off like this and you don't get to finish it, all of a sudden, like, you begin with this statement that if time would have allowed me, I would have completed my history with this. Then you can say, okay, yeah, I took history from Mr. Smith, 56 years old, and he was suffering from this. And then examiner will ask you, okay, what are your provisional diagnosis and differential diagnosis? You will tell those investigations and everything. Good. In this way, even if you mention that I'll complete my history with these, if time would have allowed me, it's as good as asking, and you'll score the marks for that. But if you'll not mention it at all, you'll lose the marks. Okay. So that's why I'm saying all this, and I'm recording it so others can also learn from this. Right.
Yeah.
Thank you.
Thank you, ma'am.